know, you bring up a very interesting segue here because, of course, awareness is only one part of everything.
Right.
Funding and really
Yes.
bringing the necessary programs to the fore are very important. Of course, medical care in America is a very controversial and expensive topic, and funding for mental health especially is a very complicated issue. And so, you know, you have successfully brought legislation, bipartisan legislation, to the fore to really help with mental health awareness and with treatment. So I guess, can you talk about what you see in terms of the funding challenges and, more importantly, also some of the innovations in treatment that you've seen implemented across the country?
Well, first, let me say, I think it's more expensive not to treat mental illness and addiction than it is to treat it. And that when we say comprehensive health care, we should mean health care above the neck as well as health care below the neck. And so, and 1 out of 5 people in our country will have some kind of a mental illness or condition in their lifetime. 1 out of 5. So this is much more mainstream than we are willing to acknowledge, which is why what Glenn's doing is so important in terms of talking about it and bringing awareness. In answering your question, I too want to start though by saying this is something that I know about personally. I grew up with a dad who was misdiagnosed multiple times and finally diagnosed correctly as being what we now call bipolar. He was at the time manic depressive. And I saw what happened when he didn't get services. And my mom's a nurse. She was director of nursing at a small hospital where I grew up in Clare. So I was around medical community all the time who misdiagnosed him. At that time, you know, I was young. This was like in the 60s, everybody was schizophrenic. That was it. I mean, there was nothing else. And
broad.
Just broad. And so when he finally got diagnosed, he finally got put on medication, lithium, that helped him. He was able, never went back in the hospital again, and was able to go on and live his life managing a chronic disease. So this is no different than somebody who's diabetic, has to check their sugar, has to take insulin, and has to manage a chronic disease. That's what this is, and we need to think of it like that. So for me, growing up and having been involved in these issues, policy issues, as an adult and now in the U.S. Senate, there's several things I've been involved with. One, when we passed the Affordable Care Act, I authored the provision of what we call mental health parity. So the insurance has to cover mental health and addiction the same way we do physical health, not higher co-pays, not limits on service and so on. And now this is unfortunately being undermined with changes, but this is important. But we don't have mental health parity in the community, and that's what the Excellence in Mental Health Act is about. We've now expanded to a second version of Excellence in Mental Health and Addiction services to broaden that out. But the whole idea is to have comprehensive services. We have now passed a law to define what a qualified behavioral health clinic looks like in terms of the quality standards, including things like a 24-hour psychiatric emergency facility, so folks aren't going to the jail or aren't being, you know, or the ER.
The emergency room.
Yeah, exactly. And so the goal is to have those facilities in every community. Not there yet, but we now have the expectation, because we've been able to pass that. We have been able to fund comprehensive services in 8 states. Michigan's not yet one of those, although we have another round coming. We're going to find out in September. We have 14 community mental health agencies that have applied for funds, so hopefully we're going to see an infusion coming in to Michigan as well. But the idea is to be able to basically provide funding for a psychiatrist, a psychologist, a social worker, the same way we fund a doctor, a nurse, and so on. Right now, you go into a health center, you go into the hospital, you are reimbursed for your service, you as a doctor. If you are working in a mental health agency, you are not fully reimbursed. There's a small Medicaid reimbursement, and then it's grants. And then what happens? The grants run out over and over again. And so I say all the time to folks, can you imagine if you needed heart surgery and the doctor would tell you that, gosh, you need heart surgery, but I'm so sorry the grant ran out. We would never say that. We say that to people with mental illness every day.
Well, right. And